My name is Karen Robinson. I'm a dietitian in the Belfast Trust in Northern Ireland. Before COVID, my role was a team lead role with a clinical caseload of hepatobiliary and critical care. When the COVID pandemic first presented itself back in March 2020, the hospital that I was based in was selected to be the COVID hospital where patients who were requiring medical or respiratory support would be admitted, and also critical care. Unfortunately, it became apparent very quickly that the number of patients that were requiring critical care support would exceed the capacity of the hospital, and therefore a regional Nightingale COVID ICU hospital with a lot more bed capacity was set up in our larger sister hospital within the Belfast Trust. And to share my experience of COVID to date and to help develop that service, I moved across to the larger sister hospital. And really up until a few weeks ago, I have remained working in the COVID critical care unit. So as with any extremely ill patient, nutrition is really important in supporting the recovery, and COVID-19 patients are no exception. So many of our patients were ventilated, requiring help with their breathing, and therefore they were unable to eat and drink. So they had to receive their nutrition artificially, which was delivered through a feeding tube. The dietitians therefore devise a nutritional management plan for these patients receiving their nutrition in this way. Many of our other patients also had swallowing difficulties and required texture modified diets. Some experienced taste problems, and some experienced poor appetites. Many also had diabetes. The dietitians were able to provide individual and tailored nutritional plans for these people to help them support them through their illness and help their recovery. Initially, the challenges was the sheer expansion and scale of the critical care service, and quite often the speed of change and processes and decisions were being made on an hourly basis, and the dietetic service was having to respond to those changes. So it was the speed at which change was happening was so fast initially. And we knew that our ICU colleagues, our medical team, our nurses, our physio colleagues, they really wanted and needed the support of the dietetic service in this critical care unit. So we knew quite quickly we were going to have to restructure the dietetic service in order to release more dietitians, in order for us to provide a safe and effective service within the new environment in which we were going to work, and this required significant planning. We had to upskill many of our dietitians who had not really had any experience, or maybe had little experience of working in critical care. So very quickly we had to put in place an education and upskilling programme so our dietitians could adapt their skills to allow them to work in this environment. Of course, we've all heard of PPE, so we ourselves had to learn how to use the correct PPE properly in order to protect ourselves. We had to learn to don, doff, which is not a normal part of our usual work. And there were time constraints of wearing the PPE as well for our own safety. So this added some time constraints onto the amount of time that we had to do our work. We all now know that the PPE, it was very hot, it was sweaty, but also posed lots of communication difficulties initially as well. So it was quite difficult to hear our patients, to hear our colleagues, to interact with each other. And communication is so key. It's such a big role of dietitians and the work that we do. So yeah, we had to work very differently. So usually we would work off electronic systems, and unfortunately they weren't available in the new environment that we were working. So we had to revert back to working traditionally with paper, and initially it felt like there was mountains of paper everywhere that we needed to navigate through in order for us to acquire the information we needed to provide individual nutritional care plans. Also within COVID, 19, this was a very new, very emerging new condition that we didn't have a lot of information about. So we had to adapt and use all of our clinical experience that we had working in critical care to tailor the nutritional plans for these patients until we have a better evidence base for this group of patients. And one of the challenges for me personally as well was to help to manage and supervise and support a team of dietitians that were working in unprecedented conditions, and to help each other work in this new environment. Whilst we had a lot of challenges and it was difficult at times, we've learned so much, or I have learned so much from the experience. I always knew, but it has really highlighted to me how committed and dedicated and hardworking the dietetic workforce is. Obviously, I was working in critical care, but the service as a whole really pulled together, and people really were very adaptable, very flexible to the circumstances. We were very resilient and so hardworking and committed to providing the best nutritional care that we could, not just to critical care patients, but to all of our patients and clients across the dietetic service. I also really learned about the importance of self-care and looking after each other and supporting each other, and how important that is. And also just appreciating the simple things in life, like fresh air and good food and adequate sleep. And really proud of the dietetic profession. I'm really proud of my team and what we've been able to achieve in the critical care setting for COVID pandemic.